Ezekiel Emanuel, a few more questions. First, Ebola. You said this week the American people shouldn't panic about it. You said we've got a great healthcare system in this country, but people are looking at this case of the man in Texas. Parents are keeping their children home from school. What should Americans do? What should they be thinking about this?
They certainly shouldn't panic, and they should not blow this up way out of proportion. First of all, we have one person who's come over, not in isolation, who took a commercial flight and didn't know whether he was infected or not, but had been exposed. Out of 310 million people, one person is not going to ignite a firestorm. It's hard to pass Ebola, and it is under control at a hospital. We do have a very good healthcare system with lots of good physicians and nurses and other healthcare providers, and we have a very good public health system where the CDC can do expert contact tracing, quarantine of a few people if necessary. We're well protected. This is not going to get out of control in the United States, and we have proof of that in Nigeria, where they don't even have nearly as good a healthcare system, and they've been able to contain the Ebola very quickly there with very, very few people out of their 177 million people getting Ebola. What we see in Liberia and Sierra Leone is a situation where you have a very poor healthcare system in countries that have been under civil war and civil strife for many decades, without infrastructure, without public health resources, without trained healthcare personnel. That's a very different circumstance in the United States. The president is really right. The chance of a widespread outbreak of Ebola, it's so remote, I just don't even think it ought to be on scenario planning.